This medial most compartment of the femoral sheath, what we call femoral canal. This compartment what we call femoral canal. This femoral canal also funnel shaped. Funnel shaped means what? It is having the base in the upper part and in the lower part it is narrow. Actually, it is around 1.5 centimeters length and width is 1.5 centimeters only at the base. At the base only it is 1.5 centimeters. This base of the medial most compartment or this base of the femoral canal, what we call femoral ring. This femoral ring having some boundaries. It is having anterior boundary, it is having posterior boundary, it is having medial boundary and it is having the lateral boundary. This is the anterior boundary. Anterior boundary is formed by, what is this ligament? Here, inguinal ligament. Posterior boundary is formed by fascia which is covering the pectineus muscle. Here there will be pectineus muscle. So that pectineus muscle will be covered by fascia. That fascia what we call pectineal fascia. Then medial boundary is formed by, what is this? Lacunar ligament. So medially lacunar ligament. Then lateral boundary is formed by the septum which is separating the venous compartment from the lymph node compartment. Actually, this lateral compartment what we call arterial compartment, middle compartment what we call venous compartment and the medial most compartment what we call lymph node compartment. Let me tell you the boundaries of femoral ring. Anteriorly by inguinal ligament, posteriorly by fascia which is covering the pectineus muscle, medially by lacunar ligament, laterally by septa which is separating the venous compartment from the lymph node compartment. So this femoral ring covered by some extraperitoneal connective tissue. This extraperitoneal connective tissue covering over the femoral ring, what we call femoral septum. The extraperitoneal connective tissue which is covering the femoral ring, what we call femoral septum. That femoral septum will be covered by parietal peritoneum and forms a depression. That depression what we call femoral fossa. So we have to remember few structures. It starts with femoral. This canal what we call femoral canal. The base of the canal what we call femoral ring. And extraperitoneal connective tissue which is covering the femoral ring what we call femoral septum. Parietal peritoneum is covering the femoral septum and forms a depression. That depression what we call femoral fossa. This is about the femoral canal. Within the femoral canal what is present? See, this lymph node. What is lymph node? Lymph node of Claquette or lymph node of Rosenmuller. It drains the lymph from the glans penis in case of males, glans clitoris in case of females and also from the superficial inguinal group of lymph nodes. So this is about the femoral canal. Through this femoral canal, some abnormal protrusion or the herniations will happen. Here abdominal contents are there. That means coils of intestine. Coils of intestine along with omentum, along with blood vessels. Those will be protruded through this gap and they pass through this canal and here there is one more opening is here in the deep fascia. This opening what we call saphenous opening. So abnormal protrusion of abdominal contents through the femoral ring. Contents will descend down first. After that they reaches to the saphenous opening. Then from the saphenous opening they comes forwards. After that they ascends up through the superficial epigastric vessels. The course of the hernia will be directed downwards, then forwards, then upwards. That means it's like a U shape. If you wanted to reduce that hernia, you have to ask the patient to flex the thigh. Then you have to follow the reverse course. That means what? First you have to push the hernia down, then backwards, then upwards. So this is how we have to reduce the femoral hernia, if it is reducible. If it is not reducible, when it will becomes not reducible, this is the sac. Within the sac, contents are present, right? So for suppose this is the intestine. This wall of the sac and the wall of the intestine. If these two are connected with each other, that time reduction is not possible. In some other cases, there will be strangulation. Strangulation is what? For suppose this is the femoral ring. Contents are passing through the femoral ring, which leads to obstruction of the contents and obstruction of the blood vessels which are supplying to this part of the intestine, which leads to avascular necrosis. To prevent that, we have to reduce the hernia by widening of this femoral ring. That means we have to cut this lacunar ligament here. We have to cut this lacunar ligament and we have to widen the femoral ring and we have to reduce the hernia. In that case, one thing you have to remember very carefully. This is the internal iliac artery. This internal iliac artery will be giving one branch like this. This is what we call obturator artery. And here, this external iliac artery will be giving one branch, that is inferior epigastric artery. This is what we call inferior epigastric artery. This inferior epigastric artery and this obturator artery will give pubic branch. Here it is giving one pubic branch, here it is giving another pubic branch. These two pubic branches will be united or anastomosed with each other and forms as abnormal obturator artery. So this is what we call abnormal obturator artery. Usually this abnormal obturator artery is present just medial to the femoral vein. That time if you cut this lacunar ligament, this blood vessel will not affect, so that we can easily reduce the hernia. But in some cases this artery is present along the margins of the lacunar ligament. In this case, if you cut the lacunar ligament, along with the lacunar ligament you will cut this artery also. That means you will cut the abnormal obturator artery, which leads to alarming bleeding. That means life threatening bleeding.